Hi, I'm Caroline, a yoga teacher with a special interest in menopause based in Edinburgh.
And hi, I'm Dr. Claire, a GP with a special interest in menopause based in North London.
Together, we are the Menopause Sisters, and we're here to guide and support you through your menopause journey. Hi, Claire.
Hello, good evening. How are you?
I'm good, thanks you. How was your Christmas?
It was all very enjoyable, actually, considering I think my expectations of what was going to be were a lot lower this year. So actually, we had a really lovely time,
That's quite.
quiet and COVID free. What about you?
Yeah, exactly the same. Quiet in Edinburgh, just the five of us, and just partly because it was safer and easier just to be self-contained. And yeah, it's been good to have a few days off, but we're both back at work now. It's Wednesday the 29th of December, and back to record another show. In this episode, we decided we would concentrate on vaginas and vaginal health through perimenopause and menopause. Yeah, I think maybe hand over to you to begin with, just to talk about how declining estrogen affects perimenopause, menopause, vaginal issues.
Yeah, so I think it's really important to remember that, as we've said before, and as we bang on a lot about, is that we have estrogen receptors in every cell of our body. And so actually what we've got to remember is that with fluctuating levels of estrogen in the perimenopause and postmenopausally, when your estrogen levels fall significantly, one of the first signs can be that sense of vaginal dryness or soreness down below. And this obviously can affect you if you've had a surgical menopause or if you've had treatment that would induce a menopause, so chemically as well. And it's often a symptom that isn't really talked about very often. It's still thought about as a bit of a taboo, which is a shame because the treatments that are out there are very, very safe, very effective, and can really change a woman's quality of life quite significantly. So essentially, the estrogen that we have in our body before the perimenopause is what helps to plump up our vaginal walls and the cells, provide extra lubrication. It's a natural lubricant, estrogen, and so it also stimulates the cells within the vagina to help encourage good bacteria, which protects against some infections. But as the levels decline, what you can find is that you get, we'll talk about more of this in a minute, won't we, Caroline? You can get more infections, so you can get thrush, you can be a bit more prone to thrush, you can be a bit more prone to a condition called bacterial vaginosis, which is not a sexually transmitted infection, but can be really common. But also your vaginal walls thin, and so they can actually become very painful to the point where you can't put on underwear and you can't sit down. And you can imagine if you're living with this day to day, but actually a bit afraid to talk about it, it can be just completely soul destroying, and your quality of life will drop.
And this is why one of the main reasons we often use the word vagina, and we've asked guests as well that brilliant question at the end of many of our interviews, from the vagina monologues. You know, what would your vagina be wearing if she or it got dressed? And one of the main reasons for that was to use the word vagina more, to make it less of a taboo, to introduce it to women again and again. Because actually, I'd been for a walk with a friend this afternoon, and she said, "Oh, do you have to get back?" And I said, "Yes, I've got a show to record, or what's your topic?" And I said, "It's all about vaginas." And she smiled and laughed. And I said, well, one of the main reasons we wanted to focus on vaginas and vagina dryness and the changes in perimenopause and menopause is also just to use the word, because so many women still feel that they can't use that word, still feel it's a bit of a taboo. And it's one of the, I guess, awkward conversations a lot of women decide they're not going to have with their GP, isn't it? They may talk about hot flushes, they may talk about, the sleep and being affected, but actually talking about the pain or the uncomfortable irritability of vaginal health is something that's still not talked about enough. And unless, I guess, it's brought up by your GP, it's maybe something that a lot of women don't offer up.
Exactly. And I think we should, as women, we should be much more confident in talking about vaginas. One of my biggest bugbears is the use of a word to cover up the word, to not use the word vagina. So, there are thousands of different names for vagina out there. And I don't know why we're so scared of using the word and having to replace it with something that seems a little bit more socially appropriate, perhaps. But I don't think using the word vagina, I'm not going to get all political on you, Karen, here, but I don't think the word vagina is socially inappropriate. It's just anatomically correct. In the same way we use penis, in the same way we use testicles, it's just part of our anatomy in the same way as an arm is or a nose is, and actually until we get over ourselves and acknowledge that, it's really difficult for us as women to get the right help and the right treatment. And if I'm really honest, the treatment is so simple and so effective that it just is so frightening that there's so many women out there living with what could be really, really easily and safely resolved.
I think it just goes back to that kind of embarrassment about sexual health generally, doesn't it, and talking about sex, and that's actually probably quite British, and it's a huge stereotype, but we're still not very good or getting better at it. And for many women they do have a nickname for their vagina. They don't use that word, and it still is seen as a bit of taboo. And obviously it depends on generations as well. I feel like the younger generations are getting more confident about using it and kind of owning that word and owning that anatomical term. But I think it is very, very, very difficult, especially for the older generation. I can think of a 70-year-old or just over 70-year-old that I know who gets to a venue and rushes to the toilet. And actually, I'm thinking, I know exactly what you need. You need some vaginal estrogen just to help with that and ease that. And I'm not a doctor, and that maybe not just be as obvious as that, but that's my initial thought. But I know that's not a conversation that particular person would have of that generation necessarily.
Yeah, and that's what's really interesting, is because, as we know, estrogen receptors line our pelvic floor, they line the base of our bladder, they line our urethras, which is our urine tube. And as we get older and estrogen levels decline, the ability for your bladder to hold on to urine weakens. And yes, rushing to the toilet can be for a number of reasons. It can be psychological. So the more you do it, the more you allow your brain to say, I need to dash to the loo, the more it will say you need to dash to the loo. So there's a cycle to break there. But actually a really easy treatment, like you said, it would be to try some estrogen vaginally to see if that helped. And in many women who suffer from vaginal dryness, they're also prone to that bladder weakness, so having to rush to the toilet, but they're also prone to kind of having recurrent urine infections, thrush we've already mentioned, and because estrogen also helps to kind of ward off some of those harmful bacteria. We need to remember that it is absolutely imperative for our vaginal health that we have it, really.
Yeah, and it's also a symptom that's not just going to disappear. Hot flushes might subside, the insomnia might ease, but actually a dry vagina is one of the few symptoms that is permanent. And as you said, it can cause itching, it can cause pain, it can cause the increased urinary frequency, incontinence, prolapse, UTIs. The list is endless. And actually, it's unfortunately something that's going to affect many women forever, for the rest of their lives. And so actually just knowing that vaginal estrogen is a possibility, and it's separate to what we would call kind of, I guess, classic HRT, the patches we talk about, the transdermal estrogen you would take in bigger doses. It's a very, very, very tiny dose, isn't it? And it's applied locally, as it were.
Yeah, so I think what's really important to remember is probably 7 or 8 out of 10 women postmenopausally will have what is technically called genitourinary symptoms of the menopause. It used to be called vaginal atrophy, but I find that quite a nasty term, so I prefer to use GSM, which is essentially vaginal dryness. But 7 to 8 out of 10 women will have this. That's a huge number of women, and it will affect, so we could, by default say it will be affecting the majority of women postmenopausally. And this is even if they already take HRT. And the reason for that is because HRT is great at providing estrogen to most of the body, but for some reason it's not quite so good at re-estrogenizing the vagina. So vaginal estrogens, which come as a cream or a gel or even a pessary or even a ring that you can insert, just give you estrogen to the vagina. And that's when we say topical estrogen. It's just estrogen that you insert into the vagina. It's very safe. It's very effective. Most women who've had a history of breast cancer can use it very, very safely. And the reason for that is because the absorption into the body is so, so tiny. I mean, obviously, you need to speak to your doctor or menopause specialist before you embark on this journey anyway. But actually, it is a very, very safe treatment, very effective. And many women find relief within a matter of weeks of using it. It's important to know, though, actually, that using it, it provides the symptomatic relief, after a few weeks, but you need to carry on using it, otherwise your symptoms will return.
I started using it probably about 5 months ago. I started, and I've spoken about this before, I'd started getting almost a sense of recurrent thrush, and that sense of almost needing the toilet a little bit more, just that uncomfortable feeling, and sometimes an occasional slight sense of burning. And it wasn't awful, but it wasn't very comfortable. Obviously, thankful that I have this knowledge, and was able to go to my GP and request that. And I have to say, within a week, it was a game changer. I've actually written to my GP and said, this is a complete game changer. I need a repeat prescription, because actually it just felt a little bit more comfortable. And one of the things that been incredibly painful through perimenopause and menopause is sex. And this is something else that, isn't talked about very often. And whilst the many symptoms of perimenopause and menopause might mean you're tired or you're just not interested whatsoever, but even regardless of that, actually, lubrication of the vagina is really key, and vaginal estrogen can really help, as well as vaginal lubricants as well, can't they?
Yeah. So, I mean, when we talk about vaginal lubricants, we're thinking of not necessarily prescribable, but there are certain ones, and obviously it depends on where you are in the world, but there are certain ones that are better than others. I wouldn't just get something over the counter without some advice, because they are often perfumed or contain some irritants to some women, which some women might find harmful. So the vaginal lubricants can help, but if I'm perfectly honest, I think there's very few women that can't use a local vaginal estrogen, either inside the vagina, so applied internally, or rubbed around the vulva, so that the skin around the vagina, to help ease some of the symptoms, because actually the vulva also thins and shrinks during the perimenopause and menopause, and vaginal estrogen cream can be really effective, and is absorbed really well in the area, and can really help with symptoms like itching and irritation as well.
Are you able to talk a little bit more about who may not be able to use vaginal estrogen? You mentioned it's a very, very, very small percentage of women. Is there anything specific, or is it a bit more too complicated to discuss today?
There are a very, very select minority of women that might not be able to use it. It's very niche. And in terms of those women, I would say I would actually say the majority of women can. If you're concerned about using vaginal estrogen, just have that conversation with your healthcare professional. Because, as I said, I don't feel worried about giving vaginal estrogen to women who've had a history of estrogen receptor positive breast cancer, because I know that it is absorbed very, very locally. And don't forget, in the UK, we follow specific guidelines that that talk about shared care, and this is a discussion between you and your healthcare professional, and a balance between risks and your quality of life. When we're talking about vaginal estrogen, there's very few risks that are there, but if you're worried, talk to your healthcare professional, because I think most women could probably safely use it.
We're going to take a pause there and listen to some messages from our sponsors.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
Welcome back. You're listening to the Menopause Sisters on UK Health Radio, and today we are discussing vaginas, everything around vaginal health and lowering estrogen levels. Something we haven't mentioned, and actually we had a participant in one of our workshops that had a lot of problems, as you mentioned earlier, Claire. It's very painful to sit down. There was a real burning sensation. She was really, really struggling with vaginal pain, and my understanding, actually, most recently, she's been diagnosed with vulvodynia, unexplained vulval pain. And I imagine that's quite unusual, is it?
I think probably the diagnosis. I mean, I see not a lot of it, but it's not sort of uncommon for me to hear about it, I guess. But that's with my menopause hat on. But it is a really, I guess, soul-destroying symptom of vulval pain, vaginal pain. It can be spasms. It can be like severe discomfort during sexual intercourse. We're not just talking mild pain. We're talking pain that is so severe. And actually, when you have that severe pain once or twice, your brain picks up on that severe pain. So every time, for example, you're going for a smear or you're about to have sex, it's that much worse because psychologically and physically, you've built that pain up to be a lot worse. It is a really common symptom in the menopause. And it can sort of be a vicious circle in that, like I said, you get the pain, you worry about the pain's more pain you get, the more you worry about it, so it gets worse. But one of the really useful treatments in the perimenopause is again just acknowledging the fact that this is existing. That's the first thing. Acknowledging and having that chat with your healthcare provider that this is a symptom, and exploring why that might be a symptom. It might not be menopause related. There might be other things going on, and the psychology behind vulvodynia and pain is huge. So you do need to be in the right space to explore that as well emotionally. It's not just a matter of here, have some vaginal estrogen, it's all going to go away. There needs to be that kind of discussion, and again, it comes back to that holistic discussion about thinking about psychological, social, emotional health and well-being, and thinking about everything that you're doing within your lifestyle. And we had a discussion, didn't we, Caroline, about kind of what to use in the vaginal area in terms of washing and things like that, didn't we?
Yeah, absolutely. And, avoiding soaps and wipes is key, because actually it comes back to the idea, and we've spoken a bit about the pH of the skin. It's very similar with the vagina. You don't want to upset the pH balance. You don't want to upset the vaginal health, or it's almost like a gut health, isn't it, with the bacteria. So, you can buy soaps and creams specifically for the vaginal area that are not going to irritate the area, but actually just using water is probably the safest option, and making sure, obviously, you are keeping yourself clean, but not using any harsh soaps or chemicals in the area to upset or create more dryness or irritability.
Yeah, exactly. And we mentioned earlier, didn't we, when we were having a chat before about kind of moisturizers and lubricants, but sort of also remembering that condoms, can be quite irritating to the vagina. So use a lubricant when having sex, but make sure that it's a sort of a water-based lubricant rather than an oil-based lubricant, partly because it will be more comfortable, but also won't dissolve the condom, which is obviously what you're using it for. So it's just something to bear in mind.
Yeah, no, absolutely. And if you are using condoms, worth just looking at, whether they are covered in spermicide, because that can be often an irritability. So maybe you investigate the condoms you are using, because they can cause UTIs and irritate the lining of the vagina as well. And sometimes that, that's going to help to alleviate some of these issues. We've talked about HRT, we've talked about local vaginal estrogen.
Maybe we should mention just the sort of types that are available. specifically in the UK.
Yeah, no, absolutely. Because I'm using a pessary, which is great. It comes with a sort of, it's almost, if you imagine a tampon with an applicator, it's a very, very much smaller version of that. And so it's actually very, very easy to insert. And it's tiny, more likely, or it's more helpful to insert it at night, actually, isn't it? So it doesn't kind of dissolve too quickly. You can use them during the day. Sometimes I do because I just forget to use it. My menopause brain. But actually, it's a really easy way of using it. You mentioned a ring earlier, actually, and that's something I'm not familiar with.
Yeah, so the pessary is a really great idea for because it is it almost comes it comes as various forms. A little tablet which is inserted and actually is less messy because it's so small and it's absorbed quite quickly. And then you've got pessaries which look sort of more like mini bullets. They're kind of waxy, very easy to insert if you've got vulvodynia, actually, because they are so smooth, and you can just put a little bit of moisturizer on the outside, so some vaginal lubricant, and insert them. And most women with vaginal pain find that that's a lot more comfortable. And then there's cream or gel. And the cream or gel is great because it can be inserted with an applicator high up in the vagina, but can also be used as a bit of a moisturizer externally. And that's also very, very safe to do. But the ring is an alternative way to use vaginal estrogen. It's really soft. It's really flexible. And it has to be inserted by your sexual health clinic or by your GP if they can do that. And it releases a very steady dose of estrogen over about 3 months. And so over that 3-month period, what you're doing is you're getting a very steady dose, a bit like the contraceptive ring, if anyone's used that, but you're getting a steady dose of estrogen into the vagina. And the plus side of this is that you're not getting any of the mess that you would potentially get with a larger pessary. So some women go off the idea of using vaginal estrogen because it can be a bit messy. You can get a bit of discharge the morning after. But it's about actually finding the right solution for you, the right kind of form of vaginal estrogen, because for some women it's absorbed so quickly they don't get any discharge, whereas for others they do. So the ring is a good option. The one thing I would say about the ring is what I tell all my women before I fit them is to use some vaginal cream or estrogen locally. So rubbing something in or just applying a little bit with your fingers and going higher and higher up for a few weeks first, because if you've got vaginal dryness, for many women, the idea of smear or the idea of inserting something vaginally can be quite frightening and can be quite painful. So just using something a bit more locally, like a cream or a gel, for a little bit to get your vagina a bit more estrogenized can be really, really helpful. But the ring is a great alternative. And if you don't, some women actually I know change themselves when they become confident to do that. And you can leave it in when you're having sex. It's not going to affect it. You can remove it. It's perfect.
That's great. And actually, I remember we talked to Dr. Helen Douglas a few weeks ago now, actually probably a couple of months ago now. And, this is one of the many symptoms she had talked about, vaginal atrophy or dryness, and how uncomfortable she had been after her surgical procedure, her surgical menopause. And she mentioned discharge. And actually, it wasn't something, vaginal dryness hadn't occurred to her because she was still getting a discharge. So she just thought that wasn't even an issue. But actually, the discharge can be very different day to day, and it can change. And that in itself can indicate vaginal dryness, can't it?
It can, yeah. And it can be kind of a compensatory compensatory effect, really, of your vaginal wall producing some fluid. And in some women who haven't had a surgical menopause and are perimenopausal and getting symptoms, it can be that you get more vaginal discharge at certain times of the month, just because you've got some underlying ovarian activity still going on. So you've still got some of your own hormones bumping around, which can cause some discharge as well.
You also mentioned smear tests there. So something I think we should probably touch on, really, really important to still be going for smear tests. Yeah. And normally you would get a letter as a reminder from your GP, wouldn't you? And, many women put these off. I know I've been guilty of putting it off for a couple of months. I feel like I have to work myself up to it because it's not generally a pleasant experience. But for many women, it can be incredibly painful as they're going through perimenopause and menopause. So this is something really worth discussing with the healthcare practitioner who's going to do your smear, isn't it?
Yeah, and I think really important to be going for your smears. So in the UK, obviously, we have a screening programme, and women will be called at various times and various points for that. It is such a simple test. It takes a few minutes, and it can save lives. So I think, even as you get to the perimenopause and menopause, where perhaps in the UK you might not be having quite so many smears or quite not so frequent smears, it will still be really beneficial to have them done. And so if you're sore vaginally, thinking about having a smear test is probably the last thing you want to be doing. But if you can be using some vaginal estrogen, actually it might be, a little bit uncomfortable, but it won't be painful. And that's what we're trying to avoid, is pain. With the best will in the world, perimenopausally, or even, before you hit the perimenopause, smears aren't nice, but they shouldn't be painful. So if you are experiencing pain during the smear, just have a think about where you are in your perimenopause journey, because it can be really easily resolved with some estrogen.
We'll take another break there and listen to some more messages from our sponsors.
UK Health Radio, the station that makes you feel good. UK Health Radio, the station that makes you feel good.
Thank you for joining us with the Menopause Sisters, and we're on UK Health Radio with our menopause show. And today we're discussing vaginas, and we've talked about vaginal estrogen, so locally, topically, which is really, really helpful for dry vaginas. One of the few symptoms that don't go away, or doesn't go away, I should say. Can cause itching, it can cause pain, it can cause increased urinary frequency, so going to the toilet more often. It can actually be the cause of incontinence, prolapse, and often sort of an increased susceptibility of UTI, so various different things. And I suffered from a kind of feeling of almost getting thrush, of cystitis, a bit of pain before I decided to go down the vaginal estrogen route, and it was incredibly helpful. Almost overnight, within a week, I felt like I'd been given a magic bullet.
Yeah, I think it's what many women feel that way. So many women, after a few days of using it, have a noticeable improvement. But it is, I mean, what we say, one caveat always say to women is it can take 3 months to really take full effect. And the reason for that is because if your vagina has been without estrogen for that amount of time, it's almost like a build-up effect. You've got to allow it to re-estrogenize slowly. There's no quick way of doing that. HRT obviously will help, but it won't do, in some women, it won't do everything. So, don't be disheartened and stop using it. It's almost like, it's a maintenance treatment. So you've got to be using it for it to be effective. Stopping it, your symptoms will return.
Yeah. A few other things that worth mentioning as well. We've talked about not using any harsh soaps in the vaginal area. We've talked very much about thinking about the condoms you're using, because sometimes the spermicides that they're covered with or packaged with can create irritability. But also just thinking about hydration. So really, really important to think about hydration as well. And if, like me, you like a coffee, I've begun to try and restrict myself to one in the morning, or one each day, but thinking about what can dehydrate you as well, but also irritate the vagina and irritate the bladder as well. So limiting caffeine can be really, really helpful, can't it?
Yeah, and actually if you've got some sort of bladder irritability where you're kind of rushing to the loo, or you just have that sense of urgency, or you need to pee all the time and it's not a urine infection, actually limiting those products that perhaps have sweeteners in. So we know that sorbitol, for example, can be quite irritant to the bladder, and so that's another really good thing to avoid if you've had some irritability in the bladder. But the other thing to really think about, and I think we're a bit more open about this these days, is not douching. So the idea that that vaginas need to be super, super clean, and we must wash them inside and out. actually even kind of showering and inserting the water into our vaginas. Just don't do it. The vaginas are naturally self-cleaning. I did have one lady who was told from a very young age that she needed to use dilute TCP to her vagina, which, if you don't know TCP, it's an antiseptic, a very, very strong antiseptic in the UK. And it's so damaging, the kind of rhetoric about how we should how our vagina should smell, how they should look, how we should groom them. Just remember, water alone is enough. Don't douche.
Yeah, and actually it's coming back to this idea of the gut biome, really, isn't it? We've got a vaginal biome as well, so we're looking at trying to keep these bacteria where they should be and not upsetting the pH, because actually we're looking at vaginal health here. So if it's helpful to think about a gut biome in your digestive system, also in your head think about your vaginal biome as well, because even eating well and supporting your gut health is going to then support your vaginal health as well. So yeah, no, absolutely. That's interesting about sorbitol. I hadn't heard of that, actually. I didn't know that sweetness could be irritable as well. So thinking about your caffeine intake, also alcohol, we both enjoy a glass of wine, but we're both really, really aware that's going to irritate the bladder, irritate the vagina as well. So, just managing these things. We're never ever saying cut things out, because that's not much fun, but just managing and becoming aware of hydration. So, and hydration isn't just water, it's herbal tea as well. It's fruit and vegetable. There's a lot of water in fruit and vegetables as well. And it's been shown that actually, downing a glass of water, you suddenly remember you haven't not had any water during the day, and actually downing it's not really going to help. You want to be trying to take sips continuously during the day to keep yourself well hydrated. Something else to think about, pelvic floor, keeping the strength there. Obviously, estrogen keeps everything firm, tight, kind of. I like to think it sort of holds everything up, but actually we can help ourselves with pelvic floor exercises, and that's something we must explore in a future episode. But Pilates particularly good for pelvic floor health, and in some yoga classes as well, that can be focused on with the physical side of yoga.
And I think that as terrible as I am about doing pelvic floor exercises, I don't think we can estimate them enough. They're a bit sort of like your physio exercises if you've got knee pain or back pain. They're maintenance, again, a bit like vaginal estrogen. You've got to be doing them, particularly if you've had children, but even if you haven't, you've got to be doing them to maintain that muscle strength. Think of it as another muscle that you're exercising, because vaginal estrogen, whilst it's great, it's only going to do so much. You need to think about it in a really holistic way and give it all that it needs. So yeah, absolutely. Pelvic floor muscle training is really brilliant, and I often say do short and long ones. So think about doing tightening those muscles, pulling up your bum as if you're trying to stop pooing, and hold on as long as you can for a few seconds and then release. And if you do that for a few times a day, sort of 30 or 40 of those a few times a day, even just when you're standing boiling the kettle, just do it then. And then a few longer ones where you try and hold it for a minute or so. That will, over time, really help stabilise your pelvic floor.
Yeah, and actually pelvic floor is linked to breathing as well. So while you're doing all of that, you're also working with your breath. And as you do it, often when we concentrate on doing something like a pelvic floor exercise, we hold our breath. So if you're doing this while you're listening and thinking about doing some pelvic floor exercise, just check you're not holding your breath. Make sure you are breathing as well, because that's really, really important as well. Something we do know is smoking lowers our estrogen levels as well, and can damage the vaginal microbiome. So, we know this. We know smoking can exacerbate or exaggerate many, many symptoms. So if you can quit or at least cut down, thinking about giving up smoking is really, really key. Something else I've got on my list is avoiding antibiotics, and there are incidences where we can't do that. But obviously avoiding antibiotics can be really helpful, because that will alter the gut microbiome, but as well the vaginal microbiome, won't it?
Yeah, exactly. So obviously if you've got a UTI, urine infection, or if you've got something that needs treatment, it needs treatment. But we've got to remember that these sort of antibiotics are great, but they won't just get rid of your bad bacteria, they'll get rid of the good bacteria too, and upset the balance in your body. And there is a lot of evidence emerging that upset in the balance can cause havoc in the body. So thinking about, like you say, feeding the body, getting those probiotics back in after you've taken a course of antibiotics, but also just really being careful what you're using. And we mentioned, this is digressing a bit, but we mentioned not using soaps and shower gels to wash your vaginal area with, but also thinking about when you're sitting in the bath and submerged, if you're using bubble baths, or if you're using perfumed bath salts, or even bath salts at all, and even just shower gels and shampoos if they're dripping down. Also, that can be really irritant to some women who are quite sensitive. So I guess it's a mind change, isn't it, about everything that you're using, and all the products that are out there that say they're suitable for the feminine region probably aren't, to be honest. Just get an emollient cream, a good cream from your GP or your chemist, and or just water.
Yeah. And it's getting out the habit as well often, isn't it? Because for those women who reach perimenopause and menopause in their kind of 40s and late 40s, early 50s, often you work out what you like. You've worked out what you feel good using, perhaps out in the bath or shower, you've got your products and you know what you like to eat, and suddenly everything's turned on its head. So it's actually, unfortunately, changing your mindset sometimes about lots of different things when you think you've got everything sorted, and then nature.
No, we never do. I think talking about it is so important, though, and talking about it with your partner. And for example, if sex is uncomfortable, you're talking about why sex might be uncomfortable, and using different methods, and talking about it with your daughters, mothers to daughters, fathers to daughters. Just having those conversations and really. I just break the taboo. It still amazes me that it is such a taboo, and I do understand why it is, because I talk about vaginas all day long and it doesn't bother me. But for some women, that having that conversation is just not something that they can go for yet.
Yeah, no, and it's going to take time, isn't it? It takes time, and it takes a sort of almost a sense of bravery in owning this particular word that we're using, vagina, because actually for so many years it's been a taboo. Something else that can help tissue repair is zinc, and we've talked about this before. It can help with sleep as well. It's not going to be a cure necessarily for vaginal dryness, but for some women it does help. And so thinking about what foods contain zinc, and when we were just investigating this earlier, with the nuts, the cashews, the chickpeas, the seafood, but oysters came up as well, didn't they, Claire? It made us smile. If you do like oysters, a bit of luxury.
Well, I couldn't quite remember what zinc was in, so I had to do a quick search, and oysters was the first thing that came up, and that's obviously not for everybody. But I thought, that's probably, oysters, bit of an aphrodisiac as well, so it might kill two birds with one stone.
We've covered a couple of conditions as well. You mentioned bacterial vaginosis and vulvodynia as well. But do you find that as a GP and a menopause specialist, you're having to ask these questions, or are you finding that women are forthcoming and beginning to talk about it a little bit more, coming kind of forearmed, as it were, with information?
I think women are definitely more informed than they were maybe even a couple of years ago. But it's still a question that many perimenopausal women will forget to tell you, more because they're just feeling a bit forgetful, not because they're withholding it or embarrassed by it, but actually when you say specifically, and you have to ask, I think, quite closed questions about menopause symptoms so that women can remember, because you can't be expected as a perimenopausal woman to remember everything. It just, your brain often doesn't work or doesn't join things up. So I often go through all the symptoms and say, have you had this? Or send them out, a climacteric score sheet. But yeah, certainly it's got better, I think, but I still specifically ask about vaginal dryness and about discomfort during sex and libido, which is all tied in one thing, because I think it's important, partly because obviously it's quality of life, but also because, like we've said, and I'm sorry to bang on about this, but the treatments out there are amazing and so effective. So I would just implore anyone that's listening that has these symptoms, don't just give up and think that that's it. Just go and speak to your healthcare professional and just get the advice. And if you don't get the advice you need, or you don't feel like you're getting the advice you need, ask for a second opinion.
Yeah. And actually, I'm going to reiterate that just even a kind of inkling of pain or soreness or UTIs, urinary tract infections, just think about this as a possibility. Yes, we have said, it could be other things going on, but do approach your doctor or GP or healthcare professional sooner rather than later, because there is nothing worse than it getting worse. This continuous discomfort and pain and burning feeling. It's just incredibly painful for so many women, and there is no real need for it because, as you say, it can be quite easily treated. And most women, the majority of women, can take a vaginal estrogen preparation of some sort.
And I think also that goes back to kind of, we just get on with things, don't we, as women? We're just like, oh, well, it's a bit painful. Oh, well, it's the menopause. Oh, well, that's just happening to everybody. I'll get through it in a few years and that'll be that. But actually, I had a really interesting conversation with a care home manager recently, because we did an audit into how many of their female residents were on vaginal estrogen, and none of them were. And that was 72 women.
Gosh.
And none of them had even had the discussion about vaginal estrogen yet. These are women with bladder irritability, urinary incontinence, so losing control of their bladders, recurrent symptoms of cystitis, and yet none of them were on vaginal estrogen. So it's about just moving away from, we're just going to get on with this, and it's just the burden we have to bear, to no, actually there's a lot you can do about this, and it's time that we all spoke up about it.
And it's one of the few, one of the symptoms, dry vaginas. This is one of the symptoms that is not going to go away. So I want to highlight that because, other symptoms might fade, might come up, different things come and go, particularly after the menopause. So once you're post-menopause as well. But this is something that is just not going to go away. So if it's affecting you in any way, is knowing that there is help and you can get that help. And I know you like to recommend a very particular book. For women that are not familiar with the kind of reading material out there are so many books around perimenopause and menopause, but one very specifically around vaginas.
Yeah, so I love this book because there's so much information out there. If you're like me, you start to delve into it, you can get a little bit lost and overwhelmed. So the one book I'd say was worth a read was a book called Me and My Menopausal Vagina by Jane Lewis. And we featured it on our Instagram account a couple of times, haven't we? And it's just a very, very good short read. You could probably read it in a couple of days. I like it because it's interspersed with pictures, which is always good for me. But it's just from a very basic point of view, but it covers everything. It covers everything we've just spoken about and more. And I would really, if you can get your hands on it, I would really, really recommend it, because I think it's it just encompasses everything about vaginas that we've just talked about.
Fantastic. That's great. I think we've used the word vagina a few times. I might have to go through now and count the number of times we have. I hope this has encouraged you, our listeners, to talk about it more, not just, with friends, family, with mothers, with daughters, but also with your healthcare professional. If you feel that this is, we are talking to you, then please know that this is really a common issue, and GPs